free available policies. So I think you could even just kind of search for, a decisional balance or a pros and cons list, and those things will actually be made available. But, if it's really, I'm also happy to try to provide some support materials, and, to contact directly with that individual wanted some additional resources.
Okay, thanks. And then you were talking about the complete hormones, which is the urine test for hormones, and there was a question about which option to choose, the 24-hour versus the first morning void.
So, with regards to whether to do the first morning void or the 24 hours, to me, the question is the patient on a hormone therapy? Because if the patient's on a hormone therapy and we just did a first morning void, what can happen is that, depending on the timing when they're taking that particular hormone, we might see abnormally high levels just because it accumulated regarding around their dosing. So if they're on hormones, usually I'm recommending that a patient do the 24-hour.
Okay, great. And then kind of along the lines of that question, the NutriBowel test that you were talking about offers a plasma or first morning void option, so what's the difference between those?
So, in distinguishing whether to do a plasma or first morning void, really that's just with regards to the amino acids. And so, a plasma is going to be more of a steady state pool of amino acids. So, I'm trying to get an assessment of, over the last, say, 21 days, this person's dietary intake, what was their overall steady state, what's their amino acid status in general. And so, for that, I would use the plasma. And with regard to the first morning void, when I'm assessing that, we're thinking the urine is really reflective of classical day, so we see, with this particular diet strategy, how were they metabolizing, integrating, and using those amino acids.
Okay, great. And then another question here. What visit do you fill out the stages of the change sheet or the change plan worksheet, or do you give that to them to work on at home, or when does that fit in?
Honestly, I'm trying to do that at all with every visit. So, we're going to kind of placing them individual habit. We're talking about what kind of key items we're trying to section perhaps. And so, in my mind, it would be something to put on your chart notes where you say, here's a particular sheet, the lifestyle element, and where I just briefly jot down, pre-consultation. And in that way, I'm almost doing it on a real-time basis, and that way I'm kind of checking in periodically as far as where to see they are, and have I used some of those tools that I mentioned to kind of push them along, and am I really exploring every single option as far as, how they can actually enact this and be successful with their own behavior change. So I hope that answered the question, I think.
Yeah, I think it did. And, a lot of clinicians out there are busy, their days just moving right along. Maybe they weren't trained as a therapist or counselor, so, it's going to take a little bit to study these stages of behavior change and everything and incorporating into the practice. But do you find that it's just easy to weave it into your practice, that it can just take a few minutes, or does it really require a lot of time?
Well, I think it's a great question. I think it's like with everything else, where it does take a little bit of practice at first. So if you say, okay, here's something standing out to me, and just briefly identify it, and then have the follow-up, at least thought or idea to describe where in that change process they are. So I think it can take at least a little bit of practice. I think honestly, even just looking at that graphical times, you can really